Do you ever stop to think about how your employees experience the healthcare system, or perhaps reflect on how you yourself have experienced the healthcare system? I have a couple of employer clients who have done some surveying of employees over the last year, and there are two pretty consistent results, and I bet neither one of those will surprise you. So I'm going to tell you what they are, and I'm going to tell you how you can help fix those two problems. So hi, my name is Allison DePauli, and I started Altiqe Consulting to help employers add control and predictability back into their benefit spend, get out of the healthcare craziness, and get back to running their business. Our clients don't hear, well, the best we could do was a less bad renewal. Our clients instead hear, this is the care that was delivered, it was the highest quality, and you paid a fair price for it. For the best advice about how to control your costs and get back to running your business, subscribe to my YouTube channel below and click the notification bell to be notified of when new videos are uploaded. So back to those two problems. Number one, out-of-pocket costs are too high. We know that. Everybody knows that. What employers don't realize is that when employees put off care because they can't afford it, that problem probably doesn't go away and snowballs into something much larger. If you have a person with diabetes that is not taking their medication because they can't afford it, you can be reasonably certain that at some point in time, they're going to end up in the emergency room and spend $40,000 of your money because they can't take a medicine that costs $25 a month. Okay? So there are ways to solve for that. The other problem is that employees, and maybe you yourself, don't trust the healthcare system. Doctors, they trust sometimes, hospitals, not so much, and certainly not insurance companies. So again, we end up in a situation where care is put off or not delivered at all because the person doesn't trust what's happening and really can't afford it either. So let me give you 3 examples of where that comes into play and a couple of solutions. MRI pricing. MRIs are much more common than they used to be, and physicians are much more likely to prescribe them than they were 5, 8, 10 years ago. Of course, the imaging is much better. It makes sense. However, there are significant differences in pricing depending on where the MRI is delivered. If it's delivered in the hospital, and often physicians will just refer to the hospital, that is the most expensive place. So if it's not urgent, if you're not in an emergent situation, you don't need to have an MRI delivered in a hospital. It can be delivered in a freestanding facility for probably half the cost. And if you have negotiated ahead of time or you've made a couple of phone calls, the MRI price might drop from $5,000 in the hospital to $1,800 at freestanding facility A, $2,200 at freestanding facility B, and $800 at freestanding facility C. Most employees have no idea how to accomplish that. And I truly believe that employees are your first line of defense in understanding and spending your dollars wisely, your healthcare dollars wisely. So that's one example. 2 others we're just going to touch on today, and I'll drop some links to some longer videos below. Cancer diagnoses, 20% of cancer diagnoses are misdiagnoses. So not necessarily the person doesn't have cancer, but they've been diagnosed with the wrong type of cancer. Can you imagine how horrifying it is to be diagnosed with cancer, receive the wrong treatment, and then have to wait until the wrong chemo clears out of your body to get the right chemo? I can't imagine that experience. And the other big item is our back surgeries, MSK, musculoskeletal issues. 30% are unnecessary. How is your employee, a garden variety person, supposed to know if a back surgery is warranted or not? So, sounds horrifying, right? Big mess. There are some simple ways to control this, and let's talk about those. So, number 1, information in your pocket. It is an inexpensive proposition in this tech age that we're in now to offer an app to your employees that will give them access to 24-hour advocacy. Somebody to call when they don't know who a provider is. if they should go to a provider, if they've gone to the right provider, if they have a bill they don't understand. And you can load those apps with all of their plan designs, their benefit cards. If you offer telehealth, you can use telehealth in there, add it right in there, and you can also access true care management. So that is a simple way to give an employee 24-hour resources. The other thing that some of those apps do is they use geofencing, and if the employee has that app on their phone and they pull into the emergency room, a pop-up will block up that says, you're in the emergency room. Would you like to talk to the nurse before you go into the emergency room? And you can save significant plan dollars that way. They can get comfortable, get their questions answered, and understand if they truly do belong in the emergency room, or if the urgent care facility down the street will work, or if they can just see their doctor the next day. So that's a big thing. Helping decide what care is right. So incorrect diagnoses are pretty common. We've talked about it with cancer and MSK issues, but it happens elsewhere as well. If you offer true care management, where you have a medical management company actually reviewing claims and diagnoses, you can help the employee access better care, make sure they're getting their care, and have somebody that they can talk through a diagnosis with. So one, this is an inexpensive way to offer some white glove service. And two, if there's anything incorrect, it can be caught early, and the care management can help you drive to the highest quality facilities. The dirty little secret in the insurance industry is that the highest quality care is generally in the bottom quartile of cost. Neither you, nor I, nor your employee has a way of finding that out. Good care management companies have plenty of resources that we don't have access to. And the other thing that often trips people up is how much medications cost. I've got a video below about all the problems in the pharmaceutical industry, so take a look at that. But there are tools, you can load them onto the benefits app, that will allow an employee to get the best price for a drug, or to use an alternate sourcing company for a prescription that will significantly lower your cost and get rid of their out-of-pocket cost. So if you're interested in leveling the playing field, if you're interested in improving the user experience for your employee, click the link below. Let's schedule some time and see if we're a good fit.